African swine fever. The disease first occurred in 1921 when warthogs in Africa were living among European pigs in British colonies. This led to mass disease in the European pigs with a high mortality. Genotype 1, which has been endemic in Spain and in Sardinia since the 1960s, came when raw meat were imported on planes. Globalization, which started in the 1950s, really helped the spread of the disease. Nowadays, since around 2007 in Georgia, there's a genotype 2. It is now endemic in Eastern Europe and the Middle European Union, and around the Caucasus regions. So the etiology of the disease. The African swine fever virus is a part of the Aphis virus genus, which is a part of the Asfarviridae. For the epidemiology, the virus is highly resistant. It can live in meat, dead carcasses, and frozen products for years. It can also live in the environment, water, and soil. There are reservoirs in Africa and in Europe. In Africa, the main reservoir is the warthog. It is very resistant to the virus, and in adult warthogs it's asymptomatic. It is a sylvatic cycle. It's only transmitted by ticks. The pigs are a dead-end host. Ornithodorus mubata, which is an African tick, has a high replication rate and allows transviral transmission. In Europe, the main reservoir are wild boars. There is a horizontal and vertical transmission between the domestic pig and the wild boar. It got into the EU through number 1, raw pork products. Number 2, vehicles and human movement. Number 3, vectors such as the soft tick Carius ereticus. And number 4, wild boar. The Carius ereticus carries genotype 1 and 2, whereas Ornithodorus mubata mostly carries genotype 1. The tick prefers warm weather such as Mediterranean countries such as Spain and Portugal. Raw meat allows a fast transmission of the virus, and wild boar allow a slow transmission of the virus. So the pathogenesis of the disease. The virus enters the body orally through saliva and nasal discharge, and the virus is shed 48 hours before clinical signs are shown. The primary replication happens in the lymphoid tissue in the tonsils and the regional lymph nodes. This leads to a replication in the macrophages and leukocytes, but it doesn't occur in the lymphocytes. Then a viremia occurs in the macrophages. And the secondary replication happens in number 1, the lymphatic tissue, such as the spleen, bone marrow, and number 2, the blood vessel endothelium. A generalized infection can also affect the liver and the kidney. So the viremia persists for months since there's no neutralizing antibodies. This means immune complexes develop in different organs. And the severity of the disease depends on the age, the immune status, and the virulent strain. In the clinical signs, there can be a peracute, acute, and subacute and chronic infection. In a peracute infection, we can see sudden death without the appearance of clinical signs. There is a 100% mortality. In acute cases, we can see fever around 40 to 42 degrees, anorexia, lethargy, and an inability to stand. The animals huddle together. We can then see bloody nasal discharge and foaming out the nostrils due to pulmonary edema and skin necrosis. This is due to the hemorrhages. And we can also see cyanosis due to the lung edema. Peracute and acute phases are caused by very virulent strains. In subacute cases, we can see milder versions of the acute clinical signs. There are more frequent central nervous system clinical signs, and we can also see focal skin necrosis on the ears, limbs, and tails. Death will often occur within 2 weeks or 1 month. In the chronic form of the disease, this mostly occurs in wild boar. It's very dangerous because since it's asymptomatic a lot of the times, it can often be forgotten about. The clinical signs are focal skin necrosis and ulcers and arteritis and respiratory signs. The mortality is around 30%, but technically African swine fever has a 100% mortality as all the animals will die within 15 months. And regardless of the virulence of the strain, abortion is always present, whether it's peracute, acute, subacute, or chronic. So in the pathology, in peracute we can see no post-mortem lesions. There's no clinical signs, just 100% death. In the acute phase, we can see hemorrhages. They're everywhere on the kidney, spleen, urinary bladder, and the liver. Even the lymph nodes are enlarged and filled with blood. They're often black lymph nodes. We can see splenomegaly and pulmonary edema, and the body cavities are filled with blood. In the chronic phase, we can see skin necrosis, ulcers, and in the chronic form of the virus, we can see muscle necrosis and ulcers on the skin. And arthritis is very common. For the diagnosis, there's no viral neutralization as there's no neutralizing antibodies. We can do a PCR from nasal discharge, or from the organ, or from the bone marrow, or from the white blood cells. The virus can be isolated using CPE within the intracytoplasmic inclusion bodies. Another diagnostic method is hemadsorption, so the virus can hide its antigen but exposes it when it's exposed to blood. And we can also use ELISA on low virulence strains. The differential diagnosis can be classical swine fever, but there's a higher mortality in African swine fever and it has extensive hemorrhages and edema. And another differential diagnosis is porcine dermatitis nephritis syndrome. So for the control, it's a notifiable disease. All animals will be killed by this virus. There is no specific prevention, and since there's no neutralizing antibodies, there is no vaccination. They tried to make an attenuated vaccine in Vietnam in 2024, but it's not recognized by any veterinary authorities. So we just need to follow the general epidemiology measures. If there is an outbreak, we need to stamp out and do protection and have a surveillance zone. There needs to also be movement restrictions, and you restock after 45 days. Vector control of ticks also needs to be done, especially for Caries erecticus. And there needs to be a ban on the import of raw meat from endemic areas. Airports and border control need to not allow pig products to go through security. And then control the number of wild boars and disinfect transport vehicles. And also ban slop feeding, as feeding pork to backyard pigs can spread the virus.